How does CGI compare to other scales? Have you ever wondered how different assessment tools measure the severity of schizophrenia symptoms? Today, we will look closely at the Clinical Global Impression Scale and how it stands out among other scales. The Clinical Global Impression Scale is a brief tool that helps clinicians assess a patient's overall illness severity, improvement, and response to treatment. It is widely used in various psychiatric disorders, including schizophrenia, and is appreciated for its simplicity and speed. When we compare the Clinical Global Impression Scale to other scales, such as the Positive and Negative Syndrome Scale and the Brief Psychiatric Rating Scale, several key differences emerge. First, the Clinical Global Impression Scale is much shorter and easier to use. It consists of only 3 items: severity of illness, global improvement, and therapeutic response. This means it can be administered in just a few minutes, unlike the Positive and Negative Syndrome Scale, which has many items and takes longer to complete. Another important aspect is that the Clinical Global Impression Scale focuses on the clinician's overall impression of the patient's condition. This is different from symptom-specific scales that measure particular symptoms. The Clinical Global Impression Scale takes into account not only symptom severity but also how those symptoms impact daily functioning and overall distress. This broad view allows clinicians to integrate various clinical information and their experience into the assessment. The Clinical Global Impression Scale is also flexible. It is not limited to schizophrenia. It can be applied to many psychiatric conditions. This makes it useful in both clinical trials and everyday practice, providing a standardized yet adaptable measure of illness severity and changes over time. One of the strengths of the Clinical Global Impression Scale is its sensitivity to change. It includes a scale that rates improvement or worsening since treatment began, which helps track how well a patient is responding to treatment in a straightforward way. However, while the Clinical Global Impression Scale is simpler than many other scales, it still requires a clinician with experience to make accurate global judgments. This reliance on clinical expertise can be a strength, but it can also be a limitation if the rater lacks experience. In summary, the Clinical Global Impression Scale offers a quick and intuitive way to assess schizophrenia severity and treatment response. It complements more detailed symptom-specific scales, making it a practical tool for both research and clinical settings. Whether you are a clinician or someone interested in understanding schizophrenia assessments, knowing how the Clinical Global Impression Scale compares to other scales can help you appreciate its role in mental health care.